Dr. Karen Gordon-Boyle. How does it feel to be chosen as one of Newsroom's phenomenal women of 2021?
It's an honor. I didn't see it coming, and I was very surprised when I got the phone call. And of course, I readily accepted. And it's nice to notice that, someone noticed that I have been doing something.
Yes, I think you've been more than doing something. I think you're a very, well-known woman. You have so many accolades, on your name. So you graduated from the Bishop's High School as a Guyana scholar. You then went on to medical school, I believe in Russia, where you graduated 7 years later. So did you always know that medicine was going to be a part of your life?
It was always a toss-up between medicine or law.
And how did you end up choosing medicine?
Well, I went to St. Stanislaus College up to 5th form, and I started at St. Rose's High School doing economics, literature, and French, and that was to do law.
Wow.
And I actually went there for 3 months, and it was just a perchance meeting. I went to the National Library to do some research, and there was a guy from Queen's College sitting opposite me, and he was doing a maths problem. And he had his calculator and he had his book, and obviously the problem was giving him licks. He was there trying to work it out, and I had to stop reading and just watch him. And I was so fascinated, and I missed the challenge of the sciences. I was always in a science stream,
right?
But at St. Stanislaus, the science stream also had art, so there was quite a lot of versatility. And I just missed the challenge of the sciences. So I said to myself, that very day I went home and I told my mom, I want to go back to the sciences.
Wow.
And that's how come I ended up going to Bishop's High School to do Phys Chem Maths. And my mother was a nurse.
So she must have been happy or proud of that.
She was. Yes. She always felt that to be a lawyer, I needed to be much more aggressive. She didn't think I was aggressive enough to be a good lawyer. So she was very happy when I chose medicine.
So basically what what you just relayed to me is that you're good at everything. You're good at every subject. That's what I literally just got that.
I think I am naturally inclined. I'm artistic as in a writer, so I was very good at literature and English, but I love the challenge of the science.
You co-founded Eureka Medical Laboratories in 1995 with your husband. It's the first ISO accredited laboratory in Guyana, or it was at that time. Why did you feel that this was a necessity for Guyana?
Well, let me give him the credit, as in that was his dream to have a laboratory because he's a medical technologist.
Right.
And I bought into the dream when I first heard it, and I thought, well, yeah, I can support this. So it was his dream, not mine. However, to have a medical laboratory, you must have a physician attached to it. And so, of course, I had my private practice. And if you're going to do something, you want to do it well, and you want to have it with some sort of standard.
Love that.
Just having a laboratory that's certified is one thing, but when you become ISO accredited, it means that on an international scale,
internationally recognized, right?
If you issue a result, you can take it to America or anywhere else, and it's supposed to be recognized as having a certain quality. And I think that's the way to go. So yeah.
You worked at the Ministry of Public Health for 22 years. Tell us what your experience was like working with them for 2 decades, and tell us about your new position at CARICOM.
So it wasn't 22 years straight. I had an 11-year period, and then another year, and then I came back recently as the Deputy Chief Medical Officer. But Ministry of Health, it was always actually a pleasure. I really enjoyed clinical practice. I spent 5 of those years doing obstetrics and gynecology, surgery, cesareans, you name it, and I loved it. And it wasn't until my own difficulty with pregnancy, because I was like 7 months pregnant and still operating, and it was a bit of a challenge.
I would imagine so, yes.
And so I had to look for something that didn't require me doing calls every other night almost at the time. And so I needed something with less stress. I ended up going to what was then called the GUM Clinic, which is where the National Treatment Center for HIV and STIs. And I discovered another love, and it was public health, which medicine proper doesn't really prepare you for.
Right.
And so that's what made me go on to do my master's in public health and so on. So there was that hiatus from the Ministry of Health where I went to study, and I worked actually with USAID on various NGO projects. But then I went back to the Ministry of Health in 2013 when I was doing my PhD. It was a requirement because they felt I was too heavily experience in HIV and STIs, and they felt I should have some more experience with chronic diseases.
Okay.
So I was there for a year as the manager for the chronic disease program, which was very interesting. I think I made some strides. I wrote the strategic plan, which is still in effect right now for the chronic disease program, and a lot of other little things that I was able to put in place. And then more recently in 2016, I was back with the ministry as the Deputy Chief Medical Officer, which was more, policy level sort of, which was, again, very interesting, very fulfilling. I loved challenges. And
I can tell.
Full of challenges.
Yes.
But what I must say is that I had an amazing team to work with. I mean, some doctors who were, especially the program managers, some of them would go way beyond the call of duty. And it was always inspiring, especially the young, really motivated doctors. They're bright and committed, and that of course motivates you to go all out to get things done.
So touch on your time at CARICOM now. What do you do at CARICOM and your role there?
Right, so I started at CARICOM this year, and I'm the program manager for health sector development.
Wow, so what does that entail?
Well, instead of looking at health development and health policies for one country, you're looking at the Caribbean, and so you look at issues, you develop policies, you bring the ministers together, you organize those meetings for ministers or chief medical officers, and get policy decisions passed that then they go back to their member states and they become implemented. So it's operating more at a policy level, but for the region as against a country.
So do you prefer on-hand experience, or do you prefer the policy side of medicine?
I do miss the on-hand. But on the other hand, policy is where decisions are made, and the decisions that can affect a population, a community,
a country,
a region.
Right.
And so it's, I guess, an efficient use of your time if you can get a policy that affects a whole region as against taking care of a patient.
We're going to touch on what I think everyone is discussing, everyone's talking about, COVID-19. COVID-19 has literally changed the world. When you heard about COVID-19, what were your expectations? Did you expect it to be what it is today? Did you expect it to have the effect on the world that it has had on the world?
Well, you see, once the World Health Organization declares a disease of public health concern, once it's declared that, it's something serious.
Right.
And so you have to move swiftly.
Okay.
And that's what we did. We immediately got our teams together and started looking at our preparedness, what we had, where, and so on, and developed a plan of action.
So this is where policy plays a pivotal role?
Yeah, okay. Policies and guidelines and money.
Right, right.
Because this is not something you necessarily would have budgeted for.
Of course.
At least not to the extent that was required. Mm-hmm. And so it meant shifting things and making sure funds were available. Remember, it's not just ministry proper in Region 4, but you also have to make sure the entire country, all the regions have those resources.
Of course.
And it meant not just, reaching people, but it also meant having to make facilities, reconstruct facilities, put in the sinks that had to be put in at entrances, and all that entailed,
right.
Setting up quarantine facilities and isolation facilities. It was a lot, and you had to move swiftly. And so that was an experience with that rapid scale up to address it, and having to call these meetings with your team and planning and strategizing with the chief medical officer and the response team from CDC, etc. And we recognized very early it also had to be a multi-sectoral response. The Ministry of Health could never respond on their own.
So what's the number one lesson that you learned, from this COVID-19 pandemic, going through it, being on the ground yourself?
I think the number one thing is having the right people, having a good team.
Right.
That are, a team that's responsive, that recognize the importance of moving swiftly. That when you come and make a visit and recommend this, and this has to be done, you must know that when you leave, they're not going to just
sit back and relax.
They're going to get it done.
Right.
By and large, I think a lot of the successes we had early was because we moved swiftly and we just had people who were so committed, who went way beyond the call of duty.
Your contribution to public health in Guyana was recognized in 2016 when you received the prestigious PAJO WHO Public Health Achievement Award. How did you feel when you realized that, you're receiving this honor, this great achievement?
I felt really proud, very, very honored, because it was, I guess, recognition of some of the programs that I had designed when I was working with USAID PEPFAR projects. And there were a lot of very neat programs that we were able to develop to address needs.
Right.
So for instance, we were able to develop a housing project for women with HIV.
Wow.
So we had a lottery to decide which women were going to get these houses, and every year we were building. So I was able to bring together Habitat for Humanity, Food for the Poor, Ministry of Housing, Ministry of Health. What was really neat, I think, was that we trained the older children of women with HIV. So they learned carpentry, masonry through Habitat for Humanity.
So this all fell under you?
Yeah.
Wow.
So they got training.
That's amazing.
At the end of the training, we gave them tools so that they can go out and be carpenters and masons and so on.
Teach a man to fish.
Exactly.
Yes.
Because we wanted to break the cycle of poverty.
Right.
And there were lots of others. We had, small enterprises like business enterprise projects for people with HIV, men and women. And with that one, I had partnered with IPED.
Right.
So they got microloans and they were taught how to manage a business. And over 200 people living with HIV benefited from that. And what I'm most proud of is initially, and I don't know if you'd have been aware of this,
Right.
but initially it was very hard for people with HIV to get a bank loan.
Oh, I did not realize that.
They were not getting bank loans.
So there's discrimination associated with them getting bank
They thought that
loans.
they were going to die
Right.
before they got to service their loan.
Right.
And so it required me having to go out on a limb and say, okay, I've done their CD4 counts, they're on treatment, we're monitoring them. So I had to fill up forms for every single one of them and to assure the lenders that they were...
So you had to get involved in filling up these forms for these patients?
Every single one of them.
Look at that.
I had to screen
These
myself.
people must be so grateful to you.
I hope so. If it made a change in their lives, yes. I mean, I can tell you the housing project emanated from a visit that I had done to a house in Berbice. And it was, the parents were HIV positive and they had two beautiful children, two little girls. And they were being evicted from their house because they were HIV positive and the other people in the yard didn't want them there. And so they got evicted and a kind neighbor took the girls in. But the girls used to have to go to the riverside to bathe.
Oh,
And the little one fell in and the big one jumped in to save her.
Yes.
And they both died. And I had met that family. And when I met them, I was so upset that, the living conditions.
Yeah.
And so when I heard 1 week after I had visited the family, 1 week after I read about their death in the newspapers, could you imagine how I felt?
Right.
And I thought, no, their death
Man,
is not going to go. Their death is not going to go like that. I have to do something.
You're a mother of 3.
Yes.
Two of which have pursued the medical field. Is that correct?
Well, so one is 31, one is 28, and one is 22.
Yes.
I have 2 boys and a girl.
Okay.
The 28-year-old is doing psychology. He's doing his master's in psychology.
Okay.
So he's doing clinical psychology so that he'll be able to counsel and so on.
Right.
And the little girl, she wants to do medicine. She's just done pre-med, her
Okay.
degree in pre-med.
Okay, understood.
And now she's preparing for what they call the MCAT.
Right.
In
to
America.
get into medical school. Okay,
Right.
good. Okay, great.
And the eldest did marketing and human resource.
And works at Facebook?
He was at Facebook.
Okay, I
But
saw
now
that.
Yes, that's right.
I was like, oh, this is cool. He works with Mark Zuckerberg. Like, how cool is that?
I don't think you ever met him, though.
Okay. But I want to know, how did you balance being a mom and being such an amazing doctor?
It was...
it was, Dr. Boy, you probably did not sleep for a certain period of time in your life. Or did you feel
When
like
I was
that?
doing obstetrics and gynecology, I didn't sleep much.
Okay.
And I got so skinny because your appetite, after you keep having irregular eating habits and you're up all night sometimes. Yeah, I lost a lot of weight. I was skinny as ever. But you have support. I mean, if I didn't have, I had a live-in nanny.
Yes,
I had a live-in nanny, at some point, Antonia.
Yeah.
And she was a darling. That helped a lot. So having a nanny, having somebody coming in and clean the house, so I had help.
Your team. Yeah,
I had
your team. Yes.
Yeah.
And what's the greatest lesson you think that you bestowed upon your kids, bestowed upon your children?
The importance of education, the importance of being independent.
Is there anything else you'd like to add to that one little girl that might be watching and thinking that this woman, is truly an inspiration to me? What would you say to her?
I would say that the sky's the limit, but it starts with investing in yourself.
Right.
And that means when you're in school, focus on school.
Education.
Be a child and get that education. There's got to be a lot of time for all the other stuff, all the distractions, the parties and the fancy clothes. Focus on getting an education.
Where does Dr. Boyle go from here?
Well, I lost my father this year, and he was a civil engineer.
Okay.
Yeah, February. He was a civil engineer, but agriculture and farming was his life, his passion.
Yeah.
And so when he died, I inherited a farm. I know
You did mention
nothing
that.
about farming.
Yes.
But I started the Springdale farm. We do eggs and poultry. And so I suspect that when I retire, I will be full-time trying to focus on making sure that grows so that I have something to leave for the children as he left it for me. I want to make sure that I have, the farm. They'll have Eureka, of course,
Yes.
but they will also have a farm.
Right. Thank you so much, Dr. Boyle. It's been a pleasure.
You're welcome, and
Okay.
thank you so much.
You're very welcome.
Bye-bye.